Your team is working at maximum capacity. Providers are seeing patients all day, the front desk is managing phones, and everyone is doing their job. Yet, at the end of every month, money is quietly slipping through the cracks. This represents total net revenue. According to the advisory board, practices lose 3 to 5% annually to charge capture errors. On a $2 million practice, that translates to $60,000 to $100,000 walking out the door annually. This financial drain rarely comes from loud, drawn-out payer disputes or malpractice issues. It happens through quiet, highly preventable documentation and coding gaps that compound rapidly when you process thousands of encounters at scale. A healthy billing cycle relies on getting claims right the first time. The baseline for first-pass claim acceptance is over 90%. But right now, many organizations are struggling with rates as low as 70 to 75%. Initial denial rates are climbing toward 12%, as payers use high-speed AI to automatically flag errors. Consequently, first-pass acceptance drops. Meanwhile, practices rely on strained human infrastructure. Across all practice types, annual billing staff turnover hits 32%. To solve this, practices are stepping off the hiring treadmill. Instead of trying to recruit and train another in-house generalist, they are moving the entire charge capture audit function to a dedicated external team. Hiring a full-time employee for charge capture audits costs $55,000 to $75,000 a year in salary, benefits, and overhead. Staffingly delivers that exact same function for roughly $20,700 a year. You replace a chaotic, high-turnover generalist operation with a stable, highly specialized, AI-powered workforce that matches the payer's technological advantage. The integration is heavily structured. During onboarding, the external specialists study your specific payer mix, your internal EMR workflows, and your clinical protocols. They build around your exact processes, rather than applying a generic template. Every connection is governed by SOC 2 Type 2, ISO 27001, and HIPAA-aligned workflows, ensuring compliance before anyone accesses a record. Getting fully operational takes 14 days. EMR access, training, and protocol setup happen within that window, leading into a live pilot. Once live, the daily rhythm is locked in. The exact same credentialed specialist works your queue every single day, backed by a supervisor who conducts a daily randomized audit to enforce accuracy. Practice owners receive a weekly performance dashboard detailing exact throughput, accuracy rates, turnaround times, and any remaining charge lag. This structured 5-step workflow takes an invisible flaw, the missed charges buried in your patient queue, and turns it into a strictly monitored, highly predictable external pipeline. We started with that 3 to 5% revenue leak. Dedicated auditing drives your manual error rate below 1%. Catching errors before denials brings rapid financial impact. Most practices see a measurable return on investment within 60 days. This is a highly mature model, currently active and proven across more than 800 medical practices nationwide. Mastering your charge capture and retention process is the highest yield operational change you can make to ensure you collect the money your providers earned. The engagement is designed with minimal friction. After the initial pilot, the service runs entirely month to month. You can scale up, scale down, or cancel with 30 days notice, meaning there are 0 long-term lock-in contracts. Bypass the generic sales presentations. Schedule a 30-minute strategy call to discuss a plan built around your EMR, payer mix, and team structure.